Am I a candidate for canthopexy, canthoplasty, ptosis repair, or blepharoplasty? Although I have monolids, my main problem has always been my droopy outer corners of my eyes. Can it be fixed with canthoplasty, canthopexy, a ptosis repair, or blepharoplasty?
Thank you for your question. Clearly, you've been doing a lot of research and you're using terms that are typically used by surgeons. So you're asking canthopexy or plasty, ptosis repair or blepharoplasty, and that you refer to your eyes as monolid. And you want to know, because your outer corners have always been low, what are the things that you should do? Well, the reality is, although your photo is helpful, it can't replace a full physical examination. So let's understand at least the terminology that you have questions about, and what are the ways that we figure out the right treatment plan for someone like yourself. First of all, when you look at the outer corners of the eyes, the position of the outer corners is based on an insertion of a tendon called the lateral canthal tendon. And it goes to the inside of the bone of the lateral orbital rim. And that position is attached directly to the bone. So when I do a procedure, and typically it's very often for a more of a reconstructive for patients who have had complications of lower eyelid surgery where their eyelids are pulled down, I do something called a drill hole canthopexy. Now what I'm doing is essentially detaching whatever attachments the eyelid has and drilling holes into the bone and reattaching the eyelids to the bone using those drill holes, mimicking what nature would have created. Now, it can be done for cosmetic reasons as well, but we have to understand that the position of the outer corner has many factors having to do with the volume of the socket, the projection of the frontal bone, the upper part of the rim of the orbit, the lower orbital rim. So there are many factors. So when we talk about enhancing the outer corner, there's a limit on how high you can make that outer corner. The other part of this equation is how much does that fold kind of obstruct the appearance of the outer corner. Cosmetic blepharoplasty, which is probably the most common procedure we perform, in many patients who have a lot of hooding, if you lift up the skin and you look at the eyes, very often the eyelid corner actually looks higher once the hooding is reduced. So we kind of have to look at you with the eyelid skin kind of rolled inward to see what your thoughts are about the outer corner position. Now, in asking the question about ptosis, now ptosis is a very specific definition. It has to do with the position of the eyelid margin and the pupil. So very often people who have a lot of hooding over their eyes or have a physical weight of skin over their eyes and fat, it creates what's called a pseudotosis, where the eyelid can appear droopy, but once that tissue is elevated, then the eyelid position becomes a little higher. All of these are factors that affect the plan based on what your ultimate desired outcome is. This is a very subjective concern. So what might be the advice that you will be getting about all the different options really depends on what would make you happy. So if you want the outer corner lifted physically, then you're talking about a canthopexy type of procedure. If you want the double eyelid procedure, you're looking at a blepharoplasty or Asian eyelid procedure. So at this point, the question that you're asking really requires a one-on-one consultation. So I recommend you seek out qualified, experienced cosmetic surgeons who can offer you the options and spend the time with you that you need to really understand what your outlook will be once the procedure is done. Unfortunately, as a specialist, I get to see a lot of patients who are unhappy with the results when they had their surgery done elsewhere. And when I listen to them, it always sounds like it had to do with communication. That the doctor did what they intended to do, but unfortunately, what the patient wanted was not being heard, and very often they actually end up with more surgery than they wanted or needed, and unfortunately miscommunication occurs, and the results after the surgery is completed are very difficult to reverse. So I guess the message there is make sure you spend time and communicate, and you are clear about what your desired outcome will be. And so with those questions addressed, I wish you the best of luck and thank you for your question.